Veterinary medicine, I believe, is very scared of change. And that's where the fear is, in my opinion, is just change.
That's where the system, I think, needs to have confident and capable generalists who say, hey, you should go to the referral center. I went to the referral center. I think it's amazing to refer. But if you can't afford it, if it's not close enough, if you just, for whatever reason, it's your personal decision. If you can't afford it, I can try, right? Because I went to veterinary school.
And the thing is, like, we don't have enough specialists. So, I mean, veterinarians should think about becoming specialists, because
yes. I'm not
people like you and I need them as much as the profession and the animals need them. It's nice to always have them in your back pocket.
Yeah.
And the problem was I was just so freaking competitive in my in Laguna Beach. I mean, I didn't trust any of the other veterinarians. Hey, everybody. Welcome to Irreplaceable Truths. I am Dr. G. I am very excited today. I have a guest that she has an incredible platform, an incredible background. If you've been on Insta, I'm pretty sure you've seen her. She's always out there. I don't want to say disrupting could be a bad word, but I'm a disruptor. I look at her as a disruptor. But questioning what we should be doing in this profession and what people are actually putting out there. I'd like to welcome Dr. Sylvalyn Hammond, the Honest Vet. How are you?
I'm doing great. Thank you so much for the warm introduction. I'm excited to be here.
Yeah. Well, you're in Charleston right now. I'm pretty sure the weather's pretty humid. I'm an East Coaster, so I know what you're going through right now. I want to get a little bit into your background first, because I think that's going to kind of set the stage, and then we can go from there. And also to all the live watchers, if you have any questions, please let us know. We have someone watching the chat room. So if you have any questions you want to, or any statements, I mean, obviously what we're going to be trying to do today is we're going to try to start a crucial conversation. We're going to break down why veterinarians are graduating vet school with fear. And I don't want to mean fear like you're like fight or flight. We're talking fear like you don't believe in yourself and you don't think you're going to be capable of doing something. And that is something that is a very hot topic. I think Dr. Hammond, you got some feet. You pushed a few buttons, if I'm not mistaken, about a week ago on Instagram, didn't you?
That's what I do. Any engagement is good engagement, as some would say. So
yeah, I mean, and that's the problem. The problem is like I look at this profession and I look at what people are doing and saying on socials or on even where social posts, and then you look at what people are truly trying to do about it, and there is this disconnect. Veterinary medicine, I believe, is very scared of change, and that's where the fear is, in my opinion, is just change. And I think a crucial conversation is to be had on why basic procedures, well, what you and I would look at as basic, are now being referred for the gold standard. And there's nothing wrong with the gold standard. As you said, there was nothing wrong with the gold standard. But is the gold standard affordable?
Yeah. And accessible, right? I mean, not every person lives in a town or a city where there are specialty clinics. And asking people to drive 3 to 4 hours to have their chicken seen, or maybe it's their old yeller, right? Their old dog, the backyard dog who needs some surgery. That's a big ask for a lot of people. Unfortunately, you're asking them to take a day off of work. You're assuming that they can get the pet 3 or 4 hours wherever they're needing to go. They might then have to stay overnight. They mightn't be able to come back. Maybe these people have families. Can't just up and go. What if you've got young kids? So it's not always an option for multiple reasons. And while I love that we have that option, we have to acknowledge that it's not practical in all situations.
Yeah, you just had the light bulb go off in my head. I think an article needs to be written for veterinary intelligence on what the new definition is of gold standard compared to 20 years ago. Because you bring up a very good point, because the cost of care at some of these referral practices are through the roof.
Yeah.
And then you also add in, they got to miss a day of work if they have to drive.
Mm-hmm.
They have to stay in a hotel overnight. They
Mm-hmm.
have family. I mean, yeah, in Southern California, we are blessed. We are blessed with amazing referral centers, but the cost of care is a huge pullback. How many referral centers do you have in Charleston right now?
We've got 2 in like within kind of Charleston, and then one that's a little north but drivable, like 30 minutes. So we have 3, like a little triangle, and they're all fantastic. We also like have a veg that recently opened up, which is really nice. We have like a really good, capable emergency clinic. But with those places comes those high price tags, and I wouldn't be able to afford some of the quotes that I see for care. My German Shepherd, rest in peace, Hugo. He was the greatest dog in the world and had a splenic tumor. And it was one of those things, I diagnosed him on vibes. I had my first son was about 7 months old. And I walked downstairs with my cup of coffee and I took one look at my dog and I was like, okay, like it's happening. Like it is happening. He was 12 and a half. And I just knew. I just looked at him. Something wasn't right. I went and checked his gums. They were still pink. Put my hand on his heart to feel that heart beating. I thought, okay, we got to get you to the clinic right away. Drove in, showed up at work, got him on the x-ray table, took that x-ray, like burst into tears. I was like, oh my gosh, like it's happening. And I have lived that scenario now. So I've been in the shoes where I'm thinking to myself, am I going to do this surgery or am I going to go to the tertiary hospital? And Hugo was my college dog. He was my soul dog. And I thought, okay, I love this dog. I'm way too emotional right now to go into surgery on my own pet. Like I'm too overwhelmed with emotion to remain calm the way that I would want a surgeon to be. So I'm not the person that wants to do surgery on my dog right now. So I called all the specialty centers. I was like, who is cutting? You know, we all know the vets in the area. And I went to the doctor that I felt the most capable with. And they quoted me $7,000. And I looked through the estimate.
With a discount?
With my veterinary discount, with my 20% or whatever it is that they give you,
yep.
It was $7,000. And then I'm sitting there and I thought, okay, like this is the dog I would do anything for. I'm going to pay it. But because I have a medical background, I'm a veterinarian, right? I went through the estimate. I'm like, I don't need another ultrasound. We know there's a big tumor in there. Get it out. Do an X-lap while you're in there. I don't care about lymph nodes or cut it out now. I don't care if he's got 3 more weeks to live. We're doing this surgery. So I was able to cut it back to like 5,500, I think, because I also picked him up the next day. I said, he doesn't need to stay 2 nights. I know what I'm doing. He's going to hate it here. And he was they actually called me. They're like, come get your dog. He's a German Shepherd hospitalized. Like you can imagine, he was not the easiest patient. He was probably having diarrhea everywhere. And anyway, so I cut that down. But I think, could I do it again? Would I do it again? How often could I do that? And then think about our technicians. I think of that all the time. These girls, most often, also sometimes guys, they're getting paid so minimally and they work tirelessly to care for animals, and then they wouldn't be able to afford to care for their own pet. And that to me just isn't right. Like that's where the system, I think, needs to have confident and capable generalists who say, hey, you should go to the referral center. I went to the referral center. I think it's amazing to refer. But if you can't afford it, if it's not close enough, if you just, for whatever reason, it's your personal decision. If you can't afford it, I can try, right? Because I went to veterinary school. I know all my anatomy. I know good surgical technique. I know that you shouldn't have blood bleeding, like you stop the bleed things, you don't contaminate the abdomen, you close the things, you fix it, like you can do it. And I think that is kind of what you were bringing up and alluding to, that there's this confidence missing, that these students say, okay, it's refer or nothing for this foreign body surgery. But if you can spay a dog, you can do a foreign body surgery. You can do a simple I would much rather do a cystotomy, a gastrotomy, a simple enterotomy than spay a fat lab any day.
Oh,
even a regular spay. I would rather do a splenectomy.
Dr. Hammond, come on. Spays, they say, are routine in vet school. It's a routine spay. And my argument is you haven't done enough of them, then there's nothing routine about a spay.
There's nothing routine about a spay. Because every dog is different. I did a spay on a cat 2 months ago and I was confused. I always, you have a system. We all have a system, right? When I'm doing my spay, I like to go for the right ovary first. The right is high and tight. Go get the hard one and then go get the easy one. So I'm in this cat and I usually never use a spay hook. I usually just reflect the bladder and check for my uterine horn, right? So I'm in this cat. I reflect the bladder. I'm like, where's my uterine horn? Like, where's the right? So I went in with my spay hook on the right side and still saw nothing. I was like, this is really weird. Like, this is my routine spay. This is a cat. This is like a 6-month-old cat. So you would think I'm going to be in and out of here in 15 minutes. So I'm like, So I went in with my fingers, swept around, pulled around a little bit, felt some stuff. And I'm not feeling it. That's really strange. I've done this, hundreds of times. So I went ahead and I extended my incision a little bit, went down, found the left one, traced it back to the uterine body, and then pulled up. Cat did not have a right uterine horn.
I have one of those.
Did not have a right uterine horn.
And then you had to go find that ovary, though.
I had to go find the ovary. And of course, it was deformed. It was like half the size of the other one. It looked like a little bean. And here's the thing, right? That's probably a surgery that maybe a specialist should have done, right? Because I'm like, is this the ovary? I think so. It's not, it doesn't look like the adrenal gland. It's in the right spot. Like, it's got to be the ovary, but it was deformed. And I used all the knowledge that I've accumulated through veterinary school and my personal experience doing the surgery to use my best clinical judgment and remove that. And then, of course, this cat 2 months later, she's doing great. So very confident that was the ovary. There was also a tiny little remnant of what should have been the uterine artery kind of tracking down that side too. So I used that as a little reassurance that I was cutting out the correct thing that looked like an ovary. And then afterwards, when I had them both out, I cut them open, right? I cut open the regular ovary and the other ovary to compare the tissue so I would sleep better. But that's exactly what we're saying is no surgery is simple. Not a single one that you do is going to be simple or straightforward. And you should do these things that challenge you and change you so that you can be prepared for the ones that don't read the book or for those emergency surgeries you might have to do because you are the only choice.
And you also have to say it is absolutely normal. Even if you've been practicing for over 20 years, if you do that 120-pound lab spay, you still worry that thing is going to bleed.
Oh, absolutely. Absolutely.
I don't care who you are.
Yeah.
I don't care how many you've done. I don't care how many sutures, how many throws, what suture you used. You're still going to be all day. Go check the gums on that dog. Go check the gums on the dog. Go look at the conjunctiva. And you'll probably lose some sleep that night. Like, okay, is that dog at home doing okay? Or I didn't get a call from the emergency clinic. I think everything's fine. And you still call them the next morning to make sure everything is okay.
And until you hear from them that morning, the whole time, you're like, I hope everything's good. I had my first surgery day after coming back from my last maternity leave. My first surgery day was a 90-pound, maybe, or maybe she's 80-pound, big 5-year-old lab. And I laughed. I said, do you guys hate me or do you think that I'm that good of a surgeon? I'm confused because this is not very nice. But of course, and I was nervous, right? I was nervous. I thought, okay, I haven't done surgery in 5 months and this is a big dog. But, I went a little slowly and I, threw a couple extra ligatures on those big pedicles and especially where you can't even see them because there was so much fat and I'm like, well, they should be here. So I'm just going to throw some extra stuff here just in case it just went slowly. And then I kept that dog. I did her first. And then I kept her throughout the day. I checked a PCV before she went home. That's just I'm like, if the PCV is holding stable from what it was preoperative, I think it was down 2%. But, she had gotten fluids. She had obviously lost some blood just in the surgery itself. So I wasn't shocked by a 2% blood loss over an 8-hour day. So I was totally okay with that. But I commented about that on social media. So talking about ruffling feathers. And I had someone say, I commented that I was nervous about the surgery and it went great. Because I also had to do a rabbit neuter that day. And as you know, rabbits can be tricky to anesthetize safely, right?
Yes.
They're very good at just dying. Unfortunately, it's a wonderful mechanism when you're a bunny in the wild and you don't want to experience being eaten alive, but it's not great when you're a doctor or someone just trying to provide care. And so I had a bunny, and then I think I also had like a dental that day that went great, but the bunny neuter went great. The spay went great. And I posted about it the next day. I said, it's so nice to have these days that go well, because I was nervous about these two procedures. And, I'm 8 years out of school. So, wanted other people to know that it's okay to be nervous, that it's okay to maintain that kind of sense of, oh no, like what if something goes wrong? Because things go wrong, but to do it anyway. Like I was nervous. I was worried, like, because I felt rusty, but I did it anyway and it went great. So that again will make me more confident and capable for future procedures. And I wrote that and someone was like, well, I don't want the doctor who's nervous ever doing surgery on my pet. And I thought, okay, well, I don't really know any veterinarians who are never, ever a little bit nervous about a surgery.
Oh my gosh. Yeah. I was about to say, you just kicked out 90% of the veterinary profession.
Yeah. Like even they know things.
Well, I mean, my wife, she's a stud, right? Stud veterinarian, amazing veterinarian. And she still freaks out with skin bleeders. Like when she goes in for a spay, she's there cauterizing the skin bleeders before she even gets in there. And I'm like, I'm like, honey, just get in there, just go. Yeah. But that's the trick to a very strong marriage. If you're both veterinarians, is do not work at the same clinic, because the days that we would have to work together, the staff would bring in the popcorn and just be like, okay, here we go. Because she takes path A, I take path B, but we both get to the same places.
Yeah.
But that's why we call it practice. There's no real right way to do anything.
Yeah.
And I think you bring up a very important point, which is like, you got to celebrate the good days.
Yeah. Absolutely.
And we don't do that. And I don't know if that's a human trait, veterinary trait, both. But, we never celebrate the good days. We only and then all we do is sit and ruminate and think about and worry about the bad. And that's another problem. And again, I don't know where that's coming from either. So we'll dive into that fun stuff.
Yeah.
So let's go into a little bit of your history. Like you grew up on you grew up on a cattle ranch, correct?
Yeah.
Your mom's a veterinarian.
Yeah. So where am I? Who am I? I grew up in southern Arizona, Tucson, Arizona. Well, actually about an hour southeast of Tucson in a tiny little town called Benson, Arizona that had about 2 stoplights my whole life until we got a Walmart when I was in high school and we got our 3rd stoplight. So that was a big, big day for the town of Benson. And
that was did you ever parade?
We didn't for that, surprisingly. There's a lot of parades in a small town, I'll tell you that, but we did not have one but it was a big deal. Like I was in high school and everyone went. Like after high school, we all went to Walmart. Like, like that's how small this town I grew up in. And we had a working cattle ranch, my family, and we owned and operated it. My mom was a veterinarian. She was actually an equine reproductive specialist. And then my father was a rancher and a cowboy. And then, I have brothers. And so we all did all the farm and ranch work. As a family, we had registered quarter horses. And then we also had certified Angus beef. And then, of course, it's a ranch, right? So we had the chickens, we had some turkeys. My brothers and I did 4-H pigs. We had a goat. I don't know why we had a goat, but of course you had to have a goat, right? Like you can't not have a goat. Sheep don't do well in Arizona. It's too hot for them. So no sheep, but yeah, I grew up. That was the life. I loved my childhood. I mean, I feel like I got to do and see and experience things that are becoming more and more uncommon, just in terms of childhood experiences. Like my brothers and I would take our horses and we would just go right off into the mountains, be home by sunset. We got lost a couple of times, but we'd pop up in the neighbors. Like we'd go through the river, pop up on the other side of the mountain, and they'd be like, "Okay, do you want to get in the trailer and I'll drive you guys all home?" We'd be like, "Yes, please." It was just a different life. It was great. And I saw my mom, she a specialist, right? Equine reproduction, because Scottsdale is like the Arabian horse capital of the world. It's sunny in Arizona, 365. It's perfect place to be if you love riding, because it's not rainy. It's not muddy. It's easy to keep horses healthy if you can keep them cool, And she would go around to different farms and ranches to help people breed their horses. And she made really good money. She basically was IVF for horses was her specialty. But that being said, a lot of these people she would go to, they'd say, oh, I've got all these barn cats that won't stop having babies. So while you're here, can you just spay and neuter all of them? And she'd say, sure, yeah, I'll just charge, I'll add it to your invoice or whatever. And we'd DKT all these cats and prop them up between boots on the bed of the truck and like spay and neuter them. And she'd tell me like, if anybody twitches, give them a little bit more stuff. Cause she was always very conscious of whether or not they were in pain. I mean, it was very humane. She made sure everybody was good. We'd stay until all the cats were up and nobody got an e-collar. Just like before I knew, she just drove off. It's like, good luck with the barn cats. Like, call me if you need me. But stuff like that. She did a crypt orchid neuter for a 4-H kid that I grew up with in our kitchen sink on his hog. Of course, again, not great medicine, right? But he didn't have any money to take this pig to somebody in a specialty clinic. Like I said, we grew up in a really small town. So like, I don't even know where he'd go. He would have had to driven like hours to find someone to do that. And, my mom was like, look, I'm rusty. Haven't done this in a long time, but I could probably do that for you. Laceration repairs on anything, the farm dog that got kicked by the horse that morning. And I remember when I graduated veterinary school, even in veterinary school, I remember being like, well, that's not how my mom did it. Like, they would be really, they were like, you got to gown in and sterile technique. And I was like, like, what is this sterile technique? Because of course, again, I'm not saying my mom was a bad doctor, and people will be upset to hear that. They're like, oh my gosh, I can't believe she was doing those things. But the thing is, a lot of those animals did very well. And so many people were very thankful that my mom tried. I remember there was a woman who lived up the street who would literally pay my mom in goat cheese for helping her goats. So if they were sick, if they needed something, my mom would show up, she would do what she could, and the woman would give her goat cheese. Because my mom cared about the animals, and she would tell them. And she never got a board complaint, and she never got, of course, I'm sure there were some that didn't do great, right? But it was her or nothing. And so I kind of take that into my practice. Obviously, it's different today. There are some lines I won't cross. I won't be doing crypt orchid neuters in my kitchen sink. Okay. But I don't live in a tiny community like that anymore.
Yeah. So, I mean, obviously what your mom did really did shape the way you are, the way you practice, and the way your mindset is.
Yeah. I mean, I would think it absolutely does. So to kind of go back to my story, I ended up going to the University of Arizona. I always knew I wanted to be a veterinarian, and it's not surprising, obviously, given my background. I saw what my mom did. I was like, that looks really great. I think I'd like to do that too. And then I went to Texas A&M. And when I was in veterinary school, I loved surgery. I loved my surgery days. And we at A&M were very privileged in that we got to go to the shelter in Houston and do surgeries basically for 2 weeks. Spays and neuters. We also got to triage all the pets that came in. And that was another opportunity for me to kind of see medicine being offered where we worked with what we had, right? We saw dogs come in with big old gnarly wounds. We had to do amputations, all of these things. All of those pets probably could have gone to specialty, right? For horrible derm cases and things like that. But these are homeless, ownerless animals. So it was like, okay, you vet students, come up with a good plan to fix this dog because you're all they've got. But it was great. It taught us to be like adaptable and again, to use what we have. And in that time, I had no concerns or worries or fears. I was loving surgery. I was jumping in. I was like, sign me up. I'll do the things. I'll cut the things. I'll fix the things. And I was shocked. My very first day ever doing surgery as a new grad, I threw up in the morning. I was so nervous. And I didn't know where that came from because I had never experienced it before. So I went to work for private practice, or not private, general practice, small animal general practice in Austin, Texas. And I was confused by that feeling. I thought, what? And I was just so afraid to mess up because I was afraid, okay, I'm doing this routine spay. The owners expect it to go perfectly. What if I mess something up? Now I have these owners who are like going to come after me and I'm going to lose this license that I worked so hard for. I had that fear. And I had it again the next week for my next surgery week. And I had it again my next week, but I kept telling myself, okay, if I just keep showing up, it will get better. And it did. It took 3 years of consistently showing up for myself and doing these surgeries to get better. But what helped was that I was working general practice in Austin, Texas, and I quickly realized that owners didn't necessarily know the difference between what was an emergency and what should come to general practice, right? I didn't want to do emergency medicine, but I ended up doing emergency medicine as a general practitioner pretty often, right? We get the dog that came in that would be retching for 3 days. I do an x-ray. I'm like, that's a GDV. Great. We get the cat that came in. It's been throwing up. Okay. Oh, it's blocked. Right. And then I'm sitting there with these animals and I'm like, okay, you should go to the referral center now. It's probably going to be like $3,000. Maybe this is, almost 10 years ago now. So it was a bit cheaper. And they're like, yeah, I don't have any money. Right. So I'm like looking at this pet and someone on my social media post said, this is like emotional blackmail, which I thought, okay, a little bit, maybe I was being emotionally blackmailed by these situations, not necessarily these pet parents, right? They're being honest with me. They're saying, right, I don't have money, right? I'm looking at this animal and I'm like, okay, well, I'm a new grad. I graduated, 3 months ago. I've never done this before, but I will do it for you. And I'll only charge you cost so that I can try and I can learn and practice. If you're willing to meet me there and do it, understanding that our risks of complications are probably going to be higher because I'm inexperienced and I don't have the staff and I don't have the special equipment. And your dog's also going to go home with you at 6 p.m. So you're going to have to be involved. And people would say, please try. Please try. I'm willing to spend, $500, $1,000, whatever for you to try. And I understand that maybe we'll euthanize on the table. Maybe my dog will die tomorrow, but I'm willing to spend that for a chance. And I did that a lot actually at my general practice in Austin. And I got to do the cystotomies. And eventually, as I kept doing these procedures, I became more capable with them to where I was actually charging for my time to do them as well, instead of just materials, but still charging significantly less than the referral centers. And I have had one negative outcome in all of those. I did have one enterotomy that's a hyst, but that dog was very sick when she came in to see me. She'd had a corn cob stuck for 7 days. So I'll never know if it was me or if it was the dog. The specific set of circumstances is unique for each case. So, but I tried.
7 days with a corn cob, chances are that dog was already toxic.
She had evidence of toxic change in her lab work. Absolutely. So,
yeah,
but I tried and you never know because every other one that I had done went great. And there were some that I didn't expect to do well. I had a dog with a linear foreign body from his stomach. Yep. It was a rope toy. It's for context.
The saw technique.
So the one knot of the rope toy had anchored at the end of the stomach, right? Couldn't pass out of the stomach. The other knot had gone perfectly past the pancreas, of course, to the proximal jejunum. And then it had bunched up back to where those two were brought together. Okay. And I didn't know that. Obviously, I did the x-ray, saw that there was obvious foreign body. It was a 5-year-old lab mix, and he was a repeat offender. Of course, he had this happen before. So I told the owner had gone to the referral center last time. So I'm telling him, he was like, this happened a year ago. I can't afford to do it again. I can't afford another $5,000. And I said, okay, I'll do my best. This is a year after my first few. And I said, I don't know what I'm going to find when I get in there. We had the talk. So I opened this dog up. I went to the one in the stomach first and removed the knot, cut that little thing to let it go. And when it unraveled, I saw that about every 4 or 5 centimeters down the, duodenum and proximal jejunum, there was a little defect. What's the word I'm looking for? An opening, essentially, into the lumen of the small intestine. A hole.
Yes.
A hole. There were 7 of them. 7 of them from the knot in the stomach to the end. So before I did anything, I said, let's go ahead and call the owner. I'm on speakerphone. I got my hands in this dog's abdomen and my team is holding the phone. And I'm explaining to him that this looks worse than we expected. And he said, well, you're already in there. No, I said, do you want me to just euthanize on the table? Because this is pretty bad. And he said, you're already in there. Let's try your best. Try your best. So I said, okay. And then literally, this sounds horrible, Dr. G, this does, but I was like, this dog's going to die. I'm going to do my best, but there are 7 perforations. That's the word I was looking for. Perforations from the lumen of the small intestine into this dog's abdomen. Like, that's very serious. There's luminal contents, guts, juice, bacteria leaking into this dog's abdomen. So anyway, I had already done the gastrotomy. That's 1 incision. I went ahead and did the incision in the enterotomy site over the other knot. That's 2 incisions. And then I had 7 perforations along the mesenteric border that I literally just freshened the edges of and closed them up. And some of them were so big that I couldn't close them this way, or I would cause a stricture or an occlusion. Yep. So I had to close them the way that you're not supposed to. I had to do like this thing where you like bring them together this way, right? For people who don't have a medical background, it's hard to explain, but that was I would have gotten slapped on the hand. They'd be like, don't do that. That's horrible. That's not going to work. And then I put on mental patches over all 9. So this dog had 9 incisions total. And he did great. He did great. I did not. I think I had to like go lie down after that. I was like, I can't do anything else today. Like, somebody else is going to have to see the rest of my appointments. Because again, this is a lunchtime thing. And I couldn't believe it. And I was like, that dog's going to die. But I had no fear of this because I told the owner that this was a guarded prognosis. I was very open with him. This was all documented. So I said, if this dog doesn't make it, I have nothing to worry about. I tried my best. I told the owner the dog might not make this. He knows I'm not a surgeon. He understands how serious it was. And he just wanted me to try. And I think that's also important for my colleagues to remember here because now I saved this dog's life. But if I hadn't, if he had died, I think I still would have been okay because I did all the things that I was supposed to do. And I still tried my best. So he could have taken me to the board. Would it have been horrible? Would I have been very sad? 100%. But I think I still should have been safe. Maybe I'm wrong.
As long as you marked it down in the chart. Yeah, I mean, that's the other thing. Just write everything down in the chart, your conversation. And nowadays it's so easy because
AI.
All the veterinarians have AI to scribe for them. Oh, absolutely. That's so awesome.
And then
oh my goodness,
those recordings are probably like in the cloud or something. Like, I'm sure those companies can go back and pull a recording if there's a dispute where they could hear me say, hey, I haven't done, you should refer. Okay. You don't want to refer. Okay. I can do it, but here are the problems with me doing it, just so you're aware. It's an informed consent. And then of course you have them sign documentation as well. And anyway, that dog did great. And I practiced like that in Austin for about 3 years. And then the pandemic hit and I had burnt myself out, to be honest. I was doing a lot of GP work in Austin. And then I was also working at my local emergency clinic one night a week.
For the girl who said she didn't want to do emergency.
Well, but I didn't. But Dr. G, as you, like we said, people don't know the difference sometimes between emergency, or people can't afford it. So there were times where I'd say, you should have gone to the emergency last night. They're like, I know, but it's $175 to walk in the door where you're like 40 or whatever my exam fee was back then. And I couldn't go. And I'd say that I understand. Do you want to go now? Because I still can't help you. I still have to refer you back. And they're like, no, I don't want to go there. That's why I'm here. Right. So, so I thought, okay, I want to be better at these emergencies that come in. I want to be confident and capable. And I want to make sure that I'm doing the standard of care to triage all these emergencies that would run in. You know, we'd have heat stroke run in sometimes in Austin because they just happened to be close to us when the dog, you know, there was a trail, like a running trail pretty close. So people would be worried about their dog. They'd pop in. So I reached out to, it was Central Texas Specialty and Emergency Center. I think it's been a while. And I said, hey, I'm a pretty new grad. I don't have a lot of emergency experience, but I'd like to get some. And I'm willing to work for $60 an hour for emergency. Like, if, you know, that's pretty low for an emergency doctor, and rightly so. I mean, it's a wild ride to be an emergency veterinarian. It's very taxing in multiple ways, which is why I didn't want to do it. But they were like, please, you're hired. Like, when can you start? So I would work at my regular clinic from 8 to 6. And then I would do a 7 to 7, like 7 p.m. to 7 a.m. shift at the ER once a week. And I loved it. And I learned a lot. But as I said, in 3 years, I was like, and I'm really tired. I'm so tired. So I moved out to Charleston, and it was kind of COVID time still. So I decided to do relief for a little while and just kind of feel out some clinics and feel out some places. Did that for about 2 years around Charleston, and started a family. I found a clinic that I love downtown Charleston. It's called All Creatures Veterinary Clinic. And here we go again with my need to do too much, to see too much, to help too much. This clinic literally saw all creatures. It was founded by a man, Dr. Doug Berger. He's an awesome veterinarian. And when he first graduated, very much like my mom, he saw all the things and he did all the things because he thought somebody needs to do it. Someone needs to show up for these animals. And I was working alongside him and I'd see him see a dog and a cat and then do a splenectomy. And then he'd go in a room with a guinea pig and then he'd do a rabbit spay. And then he'd see like a cow with a broken leg. Like, it was incredible. And I thought, thank you for reminding me that that's really what I went to vet school to do. That's what I think I want to do. That's the kind of doctor I want to be. Not that just seeing dogs and cats is wrong. If you want to just see dogs and cats, that's great. I totally understand that because that's what I did for a while. But
was there tracking at Texas A&M, or did you?
Yeah, so you could do large, mixed, or small. I tracked.
So you did mixed.
Mixed. Mm-hmm. Mm-hmm.
Okay.
Yeah, I tracked mixed, and so I saw him doing all these things, and he told me, I said, how did you learn to do all these things? He goes, the same way you did. I went to veterinary school. I have textbooks. And he said, it's 2020, text a friend, send your specialist friends some videos and they'll help you. And, it started out with him asking me, he would be off and he'd say, hey, I've got a client, a really, really good client who needs to euthanize a chicken. Her chicken's 8 years old. It's really sick and I'll walk you through it. And I thought, okay, well, I trust myself to be able to humanely euthanize anything, right? I can end an animal's suffering. I know how to do that much. I've got a textbook. I can look it up. And, he, of course, also kind of told me what he likes to do, and it went great. And then he had a bunny with GI stasis, and he's like, hey, I'd really like for them to come in and see you because they can't go to the birds and exotics. We do have a specialty exotics hospital in Mount Pleasant, but it's specialty prices. And I said, okay, well, as long as you're there by phone to help me out a little bit, that'd be awesome. And I just went from there, started seeing these things. And I realized, a lot of our knowledge does translate so much. Of course, there's nuances with these species, but it goes back to the surgical approach, right? If you can do a spay, if you know how to spay a dog and you know all the principles of surgery, then if you need to do a cystotomy, you can get out your surgical textbook, your Dr. Fossum's, and you can look up how to do a cystotomy. And I'm not ashamed to admit that there's also videos on YouTube of how to do these procedures. There are step-by-step guides from Clinician's Brief with amazing photos. And I used to print them out and bring them with me into the surgery room just in case, but I never ended up needing them. I just was it made me feel better to know they were right there with pictures in case I got stuck or in case I got lost. But I never needed them because, again, I had all that knowledge. I just was afraid to use it. And then same kind of goes to what I do a little bit with these exotics now is I tell them, I'm like, look, I saw a baby cockatiel yesterday with a deformed leg. And I told them, I'm not an avian specialist. This is why you should go to the avian specialist. But here's what I can try to do to help you. And I also phoned some of my avian specialist friends afterwards. I said, hey, I saw this bird today. Here's a video of before. Here's a video of the hobbles I placed on him. What do you think? What should I do differently? I can always have them come back in tomorrow if I need to change it. So
it's all about using your network.
Use your network, right? Yeah, I think about my mom back then. She didn't have a cell phone. She didn't have the internet. And she was doing all those things. And Dr. Berger, when he started out, he didn't have Vin or your friends where you could send them a video so easily of something. You can text the specialists.
They were the specialists back then.
Yeah, yeah.
They were.
Yeah.
And the thing is, we don't have enough specialists. So I mean, veterinarians should think about becoming specialists because
yes. I'm not
people like you and I need them as much as the profession and the animals need them. It's nice to always have them in your back pocket.
Yeah. Thank you for clarifying on that. I don't want to discourage anyone from specializing. If you have a niche of veterinary medicine that you love, 100% go become the master at that so that you can help all of us who aren't the masters still provide good care in the case that these animals can't get to you, right? And then also understand, I think that's something that there's a lot of this GP versus specialist sometimes conflict where, people think, oh, well, I'm not as good as the specialist, but I'm like, well, the specialist couldn't work up a nasty MSRP ear infection and then turn around and do, a splenectomy and then turn around and treat a dog with a possible CCL tear. and then turn around and see somebody who's got no money for this puppy with like parvo, right? And I'm not saying that that's wrong. They have their strengths and we have ours. And it's beautiful that we have all of that in veterinary medicine. And it's beautiful if you also want to invest in being like a wellness doctor. If you want to be the vet who just does wellness care, or maybe like senior pets or your jam, I like that too. I love that too. We need that too. But we can't lose the bulk of veterinarians who are willing to do as much as they can within their means. Does that make sense? I hope I'm coming across without stepping on any toes.
No, it makes complete sense. And also, if you just want to be that general practitioner, but you also want to specialize, there's ABVP.
Yeah.
I mean, you can be a general practitioner, but be a specialist when it comes to general practice.
Yeah.
And then you can also specialize within that. There was right down the street, there was an ABVP veterinarian who did neurology. And guess what? He was a neurologist until the board certified neurologist came into town.
Yeah.
And there's nothing wrong with that. That you know, I'm going to admit, I read both volumes of Ettinger. I read the infectious diseases. I was ready to take that test, and then they lost me when they said you got to get recertified. I think it was every 5 years. Now it's every 10 years. And you also have to write 2 publishable papers. And I'm like, I own a practice. I have 3 young daughters at home. My wife works full time.
Yeah.
I don't have time to write a paper.
Yeah.
So
that's a big block for a lot of us.
Yeah, but I guess if it was easy, everyone would do it, right?
Exactly. And Dr. G, you led me to a great point. And that was one thing I felt people missed on my previous post. I'm not saying that every veterinarian has to do everything. I'm not saying you have to do all of the surgeries and see all of the species. But I'm saying maybe like within dogs and cats, consider doing a little bit more, or, you know, or getting comfortable with doing a little bit more, or remembering to occasionally step outside your comfort zone if referral is not an option. Or if you don't love surgery, consider maybe doing more internal medicine stuff. Get really good at ultrasound, or, you know, get really, really good at dental if you like dental. And then you mentioned this to me before. You said a lot of veterinarians don't work together within their community. And I completely agree with that, because if there's a lot of veterinarians practicing this way, right? Like a general practitioner who does a lot of dogs and cat stuff, but also really likes birds or chickens, right? Or I have a friend like that. She does dogs and cats. She's a dog and cat, but she also sees chickens just randomly. She loves chickens. She had backyard chickens growing up. She's got backyard chickens now. She loves she's my chicken go-to. You just got to network. You got to find people. And so that's a random, but like, let's say she and I worked in the same town, or maybe even like an hour away. I could say, hey, I don't see chickens, but I know someone who does, who's a general practitioner who can do pretty good medicine for an affordable price on your chicken, right? She's not an avian specialist, but is she kind of a chicken specialist? I mean, I can't say that, but she probably knows quite a lot. And I had a friend from veterinary school about a year after we both graduated. He was doing like TPLOs in San Antonio. And I knew he was doing them. And so I would tell people in Austin, I'd say, you should go to the referral center. But if you can't go, I know someone who does TPLOs in San Antonio if you're willing to go see him. And that became like his thing. And I knew he was a person that I could send people to. And I think today we're not doing that, and we should be. And you said that. I got that you gave me a light bulb moment. I was like, why aren't we doing that more?
What, the fragmentation of the profession? Well, yeah. I mean, that's the biggest problem, is just like you have all these veterinary clinics that all have the same difficulties, right? Staff, doctors, not enough patients, and they don't talk to each other. And can you imagine if a couple of those practices just move together? You know, obviously the cultures might be a little different, but you work on that. But all of a sudden you have twice the staff, you have twice the doctors, you bring in both your set of clients in together. It works great. I mean, I was guilty of that. And the problem was I was just so freaking competitive in my in Laguna Beach. I mean, I didn't trust any of the other veterinarians. And it was just because I which was unfortunate. I mean, because they were all wonderful, but I mean, they would make some medical decisions. You'd be like, huh? What? You know, it would just be a little difficult that way, but I was guilty of that as well. But, you know, now stepping away, hindsight's 2020 always. And I can always tell that, like, that, I really should have worked more with them. I should have done stuff like that with them. But I was also there were things too that really annoyed me because I still am the medical director of the Laguna Beach animal shelter down there, and but the thing is, like, they would do low cost spay neuter in the month of April and May, and people who really couldn't afford spay neuters or they just wanted a cheap spay neuter, they could buy this little certificate which was free, and I would get paid like $100 per animal to spay or neuter them, and that included lab work, IV catheter, fluids,
Nice.
pain meds,
That's a great deal.
to go home. Yeah, exactly. Because I always told the shelter, if I'm going to be your medical director, we're going to do high quality medicine, because I think if anything, shelter animals need more help than owned animals because you're trying to place them somewhere.
Yeah.
And none of the other veterinary clinics really got involved. I think I did 35 of them one year.
Wow.
And everywhere else was sitting at about 4 or 5. But that's how it goes. I mean, not everyone believes in that. And the other thing I also wanted to bring out, if you do want to specialize, what would you do? I know exactly what I would do. What if you were to say, hey, I'm going to specialize in something, what would it be?
Me?
Yeah.
This is funny. I think as vets, like within our friends, like over dinner, we have this conversation. I'm always like, I don't know. Cause it used to be, I'll tell you right now, and I might get some heat for this from people who went this route, but it would have been radiology, ultrasounds and x-rays. The way my brain works is I can, like, I don't know, pattern recognition in my brain is like very strong. And so x-rays and ultrasounds, like I've always been really good at looking at the picture and being like, okay, that right there, that's not normal. That reminds me of this thing. And then I can always go compare it in the book. So I've always been very confident in that. But the reason I don't think that would be my answer anymore is that I do think AI is taking its, time, kind of like edging in there. A lot of people are going to AI to read x-rays now. And it's really amazing. I don't 100% trust it just yet. I think I would rather still have like a safety net, like have AI scan it, whatever, and then still want somebody to look at it or whatever. And just for fun sometimes, and people probably get mad at me for this too, because I know there's environmental impacts, but I'll take a picture of an x-ray and I'll look at it and I'll be, okay, this definitely is this. And I'll put it in ChatGPT. Most of the time it agrees with me. There's one time where it was like, oh, it's got a broken leg. I was like, no, there's definitely not a broken leg here. So you're not ready. ChatGPT, you are not ready for this. Like, but I think someday we might get there. And then you won't really need the radiologist as much anymore.
OpenAI wasn't created to look at x-rays. There's specific platforms that do x-ray AI because you got to train it.
I'm just having fun. I'm experimenting. That's what I do.
Well, the thing is, what you got to do is before you put anything in a ChatGPT, always write these words in first. Set temperature to 0, period. It cranks up the engines, it makes it work harder, and it makes it more accurate.
I've never heard that before. Are you like tricking me? Are you going to make fun
No,
of
I'm
me?
not. I'm not. No, you're not. It's not going to show some naked man jumping out of a bush or something like that.
If I put that in ChatGPT, like I'm scared.
Yeah. No, I mean, the thing is that, obviously I'm an academician and a researcher now, and I use chat all the time. Yeah. I mean, I talk to my chat in my car. As soon as I get it, I'm 52 years old. Marijuana is legal in California, so I tend to forget things sometimes. But if I talk in the chat, it keeps it going, and it also keeps a log of all your conversations, so it really helps. And it actually drives my all my companion is at my content studio now crazy, because I really I'm teaching them the benefits of it. Like, it could really help you.